The VA supports treatment for soldiers like me in these states, and they should be able to include Pennsylvania soldiers who are diagnosed with post-traumatic stress disorder. Yes, I followed the advice of a qualified herbalist, the same advice offered by medical doctors in other states. Now I have these results to share with you. My PTS symptoms have subsided greatly. I'm able to maintain a healthy weight. What's more, I've continued my education, worked steadily, volunteered at a local Armed Forces Recruitment Center, and even promoted to Sargent in the United States Army. Clearly, marijuana has had no negative effects on my work and performance. But these positive results can come with a great penalty. Sadly, I come to you today to inform you that the so-called war on drugs has struck me hard. My career with the United States Army is coming to an end. I've been formally asked to accept the general discharge. I will not be able to volunteer for redeployment with my fellow soldiers as planned. I've been labeled as a drug user. This harsh label will only succeed to tarnish my image, damage my future, and strip me to veterans' benefits, which I have earned as a defender of my country along with its fellow citizens. Unfortunately, my story is not so unique. Here in Pennsylvania, many soldiers, myself included, are given only two options: suffer and to struggle without treatment, or leave the ranks of our military with nothing to show for our bravery. Please allow me to share with you a story of a Navy vet. Frank Barty served the U.S. Navy September 15, 1988. He was stationed on an aircraft carrier and later served as a recruiter. According to his written testimony submitted for this hearing, and he states, I started having problems with my back in January 1995, and by May 1995, I had my first back surgery to debulk and detether the litmo at the L4 and L5 region. Navy doctors prescribed oral morphine for the pain. I was still in constant pain because I took the minimum I could to stand easy of the side effects. Constipation, no appetite, feeling looped out, and no drive are just some of the negative effects I've suffered. Over the subsequent years, I have two more surgeries, hoping to get some relief. I also did many alternative methods: acupuncture, physical therapy, creams to relieve the pain. The Navy and the VA just kept handing me more and more oral medication. In March of 2004, I could not work anymore and was placed on disability. In 2008, the VA switched to methadone and Vicodin to save them money. These drugs make it easy to give up and just be left in doubt. That is not why I am, and I must fight every day to get little relief with a lot of side effects. The VA now permits cannabis use in states with medical marijuana programs, but not Pennsylvania. If I use it here, I could lose my benefits. Any other veteran could lose their benefits, such as the troubles that I'm currently facing. I understand the chance that some people will abuse this new bill, just like many people abuse other sources of food or recreation. In closing, I'd like to think on the words of our former President, Jimmy Carter. Penalties against drug use should not be more damaging than the drug itself. Thank you. I apologize. I don't get a chance to speak in public. People let alone ask my opinion, so this is still new to me.
Oh, no worries. Great job. Great job. I want to thank both of you for your testimony, and I just wanted to maybe follow up on a couple of things. You heard both the prior speakers were talking about this relates to going through the process of the FDA, getting the approvals that the last speaker actually said he wasn't in disagreement, and he did see, just like this, to the medicine, that there are some medicinal purposes, but allowing those to be filtered through the system. What is your response to that? Instead of states carving out this process, allowing the regulated process to go forth to present these medicines that would rectify a lot of the problem?
Marijuana is currently a Schedule I controlled substance. It is a Schedule I controlled substance in the Pennsylvania Crimes Code and in the Federal Code. It is a Schedule I controlled substance, meaning that it is a high likelihood of abuse and no medicinal value whatsoever. Opiates and cocaine are Schedule II because they have been recognized to have medicinal value. In order for the FDA to conduct the type of studies that would be necessary to satisfy Dr. Capretto's concerns, marijuana would have to move from a Schedule I to a Schedule II controlled substance. And there is no movement on that on the federal level whatsoever. So the answer then is, well, I'm sorry if you're suffering from cancer, but you're simply going to have to wait years before we can address this issue in Pennsylvania. I know they've done it in California, New Mexico, Colorado, Oregon, Washington, Michigan, Maine, Vermont, Rhode Island, and New Jersey, and in the District of Columbia, but you unfortunately are stuck in Pennsylvania, so you've got to wait. Also, the FDA approval process has brought us such winners as OxyContin, fentanyl, Percocet, and Vicodin, which, while effective for the treatment of pain, also have a high risk of addiction, a high risk of abuse, and a high risk of overdose. So even with those components, the FDA says, well, you know, you can use them, but you could die, you could get addicted, so here, take your best chance. Alternatively, we have hundreds, if not thousands of years of anecdotal evidence showing that a natural plant, not a manufactured substance, not a combination of a number of manufactured chemical compounds made into a little pill, but a naturally growing plant can be used safely, effectively, and without any of the risks associated with medications that have received FDA approval. Pennsylvania is not the first state to consider this. The United States of America is not the first country in which its citizens have considered or turned to medicinal marijuana. So my answer is, when you consider Dr. Grinspoon's testimony, when you consider Dr. Weck's testimony, when you consider the growing body of medical evidence, the huge body of anecdotal evidence, I believe that the evidence is there for you as legislatures to conclude that this can be used safely in the Commonwealth of Pennsylvania in the confines of an established bona fide patient-physician relationship. One of the things that I know people are concerned about here in the Commonwealth is that if we pass House Bill 1393, that we're going to have marijuana shops and marijuana doctors popping up on every street corner. You know, Dr. Feelgood, come on in, all you need is a driver's license and I'll give you a recommendation. That is not our bill. Our bill requires the bona fide physician-patient relationship where a physician whom we trust to make informed decisions about our medical care will have an additional treatment option to discuss with their patient. Now, clearly, if a physician is treating someone in recovery and that patient comes in and says, you know, I think I want to try medical marijuana, that physician may very well be reluctant to prescribe medical marijuana or recommend medical marijuana for someone in opiate or alcohol recovery. Additionally, does there exist a chance for fraud? Of course. Right now, we have people that go to their physicians every day to complain about phantom pains in their back, and they walk away with a prescription for opiate medication, addictive opiate medication. Could that happen with medicinal marijuana? Yes. But really what this boils down to, what this bill boils down to, is providing a treatment option to a physician and their patient that can be explored within the confines of that relationship.
Help me, because I can't remember in this bill if it even identifies this, but how would the marijuana be supplied to be offered? Is this, will they have independent shops? Will it be from the doctor's office via his relationship or her relationship with whatever supplier? How would that work?
It provides for two sources. One is for individual patients who have been so certified by the Department of Health. Pennsylvania Department of Health would be tasked for implementing this bill. So a legitimate cannabis patient could cultivate up to 6 plants of marijuana and possess up to an ounce of usable marijuana at any given time. It also calls for the establishment of compassionate use centers, which would be a center that is responsible for growing, distributing, taxing, and would be subject to oversight by the Pennsylvania Department of Revenue. Now, the most extreme example of this is in California, where shops are popping up left and right. New Jersey has yet to implement their law, so that may be somewhere for us to look. But most recently, Maine has started to license compassionate use centers. They had a lottery or took applications, and they licensed either between 6 or 8 compassionate use centers. And one of those was a nonprofit organization from California. They established a Maine subsidiary, and that organization was able to get a license from the Department of Health. They will be responsible for growing. They'll be responsible for cultivating. They'll be responsible for revenue collection, and they'll be subject to oversight from the Department of Health. So the model that we would envision in Pennsylvania is similar, where a nonprofit organization would make application to the Department of Health. The Department of Health would, of course, vet the applicants to see that there are no drug felons who are seeking the license, and then allow for the establishment of a compassionate use center.
And they can be located anywhere, as long as they meet these criteria. There's not a limitation of where they can.
Not in the bill as it's written. That would be up to, again, as we've heard before, the devil's in the details. That would be up to the Department of Health to determine, does Pittsburgh, for example, need one compassionate use center? Do we need a dozen? Do we need 100? Or would one compassionate use center in Harrisburg be sufficient for the entire state? Now, New Jersey had looked at having Rutgers grow all the medical marijuana, and then it would be distributed probably by the state in like a state store type of scenario. But Rutgers declined because of the amount of federal grants that they receive, and they said we can't risk our relationship. And I would imagine that the exact same thing would hold true here in Pennsylvania if the university, if Penn State or Pitt were approached for a similar scheme.
Thank you both for your testimony. I really appreciate you being here. This will conclude our hearing today. I want to thank all of you for taking some time and coming, and everyone who testified. I really appreciate the testimony. As you all know, this is not the end nor the beginning. This is going to be, I think, a very intense process. But I do want to thank you all for your contribution to it, and we look forward to having you stay involved as this bill moves forward. So thank you all for being here.
Thank you.